The top stories tonight in Y News. Travelers going to Metro Manila and Bulacan must present their COVID-19 vaccination cards at checkpoints before entering quarantine borders.
The Philippines has detected 29 more cases of the Omicron coronavirus variant, raising the total confirmed infections in the country to 43.
Testing laboratories in Metro Manila are under strain as positivity rate reaches record high.
And a Swedish man saved by a drone defibrillator makes medical history.
Good evening, Philippines and the world. Today is Thursday, January 6, 2022. Join us in the next hour as we deliver today's top stories around the Philippines and in other parts of the world. I am Herlene Delgado.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I am William Pino.
First in the news. Travelers going to Metro Manila and Bulacan are now required to present their COVID-19 vaccination cards in checkpoints before entering quarantine borders. Leia Ilagan will tell us why.
Due to the continuous surge of COVID-19 cases in the country, Metro Manila mayors agreed to restrict the movement of unvaccinated individuals in Metro Manila. This prompted the Philippine National Police to again conduct a border checkpoint for travelers entering Metro Manila. In a statement, PNP Chief Police General Junardo Carlos said that those without vaccination cards will be barred from entering Metro Manila and will be advised to return. Aside from this, General Carlos also said that the PNP will assist in the enforcement of mandates that will require the public to present valid vaccination cards upon entry to malls and other establishments.
Ang PNP po ay tutugon at tutulong po sa ating mga local government units sa pagpapatupad ng hindi naman ban, ngunit to refrain yun po mga kasama natin na mga unvaccinated. Hindi po natin sila mapapayagan na pumunta sa mga leisure areas. Ito ay pagsunod dun sa direktiba na ipapatupad ng iba't ibang mga LGUs.
General Carlos therefore reminded policemen to observe maximum tolerance.
Again, ang amin pong gagawin ay siguraduhin lang po natin yung pagsunod sa health protocols at mas maging ligtas, lalong-lalo na po yung mga unvaccinated na kababayan natin, mas maging ligtas sila na sila ay hindi po mahawa o hindi man sila ma-expose.
The PNP chief also appeals to the public to cooperate to the authorities for their safety.
Kaya nakikiusap po kami na sila po ay manatili sa kanilang pong mga tahanan at yung limited po yung kanilang mga movement for essential lang po mga activities.
The National Capital Region, Bulacan, Cavite and Rizal are under Alert Level 3 until January 15 amid rising COVID-19 cases. Laguna is also set to be placed under the heightened classification beginning January 7 to 15. Leia Ilagan, UNTV, News and Rescue. We serve the people. We give glory to God.
An epidemiologist and infectious diseases expert disagrees with a comment of an Opta research fellow about the Omicron COVID-19 variant being a natural vaccine. According to experts, the public must not ignore the variant despite its less severe symptoms. Aiko Miguel will tell us why.
The Omicron variant cannot be considered as a natural vaccine, according to epidemiologist and infectious diseases expert Dr. Eric Tayag. Dr. Tayag warns that the effects of Omicron variant of concern may be misinterpreted.
It's a virus, okay? Mali na tawagin siyang natural vaccine. No, it's not a vaccine, it's a virus. So don't call it a natural vaccine. Okay, don't overinterpret it.
Infectious diseases expert and vaccine expert panel member Dr. Rod Ginsolante also explained that an individual infected with any COVID-19 variant naturally produces antibodies. But this doesn't mean COVID-19 vaccines should be disregarded.
It may not protect us totally. Okay? It may not protect us totally against a future variant of concern. But for the current Omicron variant-driven surge, if everybody has mild symptoms, everybody will have antibody, then that will in a way can protect us also. So that means that if everyone has Omicron, then the one that also stops that is the antibody that we produce with Omicron.
This was the expert statement after Octa Research Fellow Nicanor Austriaco said that Omicron is a natural vaccine and the emergence of Omicron variant is the beginning of the end of COVID-19 pandemic.
Now, we have to realize that Omicron is the beginning of the end of the pandemic. Omicron is actually a blessing. It will be hard for 1 month, but afterwards it should be a blessing.
According to the experts, Omicron is not the last COVID-19 variant to exist.
It may be the end of this Omicron variant-driven surge, but for another variant causing another surge, this will not affect and this will not protect us.
Baka ma-misinterpret na sige magpahawa-hawa na tayo para mag-end na yung pandemic. Yun lang ang caution doon. That's not hindi tamang pag-iisip yan.
Experts also warn the public not to be complacent and disregard the mild symptoms of Omicron variant.
It contains genetic material from the coronavirus that causes the common cold. Okay, it doesn't penetrate our lungs. Okay, but you can still die of Omicron, lalo na pag na-overwhelm yung health system natin. But our capacity sa healthcare, walang doktor, walang ventilator, walang gamot, walang ganito, di mamamatay ka pa rin. Kahit yan na mild, hindi natin alam yung long-term consequences. Di ba meron tayong long-term COVID? Ba't ka magbabaka sakali na? Yes, mild ngayon, pero mamaya may long-term pa rin yun.
There are reports showing those infected with COVID-19 vaccine experience long-term COVID like frequent headache, cough, shortness of breath, difficulty in speech, and some even have diabetes as part of its long-term effects. Health experts remind the public to immediately isolate themselves when experiencing mild symptoms like cough, colds, chills, or fever. Meanwhile, the Department of Health reports 29 new Omicron cases in the Philippines. 10 are returning overseas Filipinos and 19 are local cases, all from National Capital Region. There are now 43 total Omicron variant cases in the Philippines. Aiko Miguel, UNTV News and Rescue. We serve the people, we give glory to God.
The Philippines' new COVID-19 cases soared to 17,220 today. This new figure was the highest single-day tally since September 27, 2021, with 18,449 cases at the time. These new cases pushed the cumulative count to 2,888,917, of which 56,561 are still being treated. Of the active cases, 1,837 patients showed no symptoms, while 49,988 have mild symptoms. 2,954 were in moderate condition, 1,470 have severe symptoms, and 312 were in critical condition. It was also noted that 81 more fatalities were confirmed, bringing the death count to 51,743, or 1.79% of the total case count. However, 616 more patients recovered. This figure caused the recovery count to jump to 2,780,613, or 96.3% of the overall tally of cases. Meanwhile, the overall global COVID-19 caseload has topped 297,896,231, while the deaths have surged to 5,466,641, according to the Johns Hopkins University. The U.S. is the worst-hit country with the world's highest number of cases and deaths at 57,762,144 and 832,148 respectively, according to the CSSE. In terms of infections, India follows in the second place with 35,100,000 109,286 cases, and 482,876 deaths. In terms of deaths, Brazil comes second with 619,654 fatalities.
The demand for COVID-19 tests is increasing in Metro Manila amid the rising cases, evidently putting pressure on testing laboratories. Janice Inhente explains why.
Many individuals are now keying up in COVID-19 testing facilities and online registration sites just to get tested. This is to immediately confirm if they are positive for COVID-19 and for them to undergo self-isolation. The problem is the increasing backlog in testing centers due to the high number of individuals wanting to be tested. In the advisory released last night by the Quezon City local government, registration site for free swab testing in the City Health Department has been temporarily closed due to the increased number of registries. The notice stated that registration will be opened again tonight. The LGU also emphasized that walk-ins are now prohibited in their testing facilities. Even the National Kidney and Transplant Institute or NKTI is limiting their accommodations to 100 patients per day for the RT-PCR testing and will be divided into 2 shifts per day. According to NKTI, this is because many of their laboratory staff are quarantined due to COVID-19. Some private testing centers have also limited their operations, while others stopped accepting RT-PCR requests to finish all their pending results from January 3 to 4. There are private testing centers that already implemented cut-offs to give more time to process the results of specimens. They also temporarily stopped the home service swab test to focus on walk-in and drive-through COVID-19 testing. Meanwhile, if some testing centers limit their operations to some LGUs in Metro Manila, free swab testing will still continue for individuals who experience symptoms and those who have been exposed to COVID-19 patients. To avail testing services, contact your LGU or City Health Department for schedule. Janice Inhente, UNTV, News and Rescue. We serve the people, we give glory to God.
Infectious disease experts are in support to allow the use of self-administered antigen tests in homes. This as the country records high number of COVID-19 cases amid the presence of the Omicron variant. For some members of the government's expert panel, the antigen self-test kits will make COVID-19 testing accessible and help those who are symptomatic to test themselves at home.
The antigen tests are good, lalo na yung home-administered ones, kasi then you don't have to go out and potentially infect other people when you have symptoms. But the most important thing talaga that you can do when you are symptomatic, especially if you only have mild symptoms and you're fully vaccinated, mababa naman yung risk na you're gonna have severe symptoms, is really to stay put and not infect anybody else.
I advocated for the home testing, especially for those having symptoms. The advantage there is that if you're symptomatic and you get the test and you're positive, you can isolate yourself, you can do contact tracing early on and prevent the transmission compared to going out and having the RT-PCR.
Infectious disease expert Dr. Eric Tayag is also in favor, but also highlighted the need to educate the public in using the test kits properly.
Kailangan talaga ng FDA approval kasi maraming fly-by-night na testing. Naku, naglipa na sa online. Dapat mag-guide yung magte-testing kung paano ginagawa. Baka mamaya, dito lang sa dulo ng ilong yung pag-swab. May tamang procedure. Kung hindi, false negative yun.
Health Secretary Francisco Duque III says he is in talks with the Food and Drug Administration or FDA to revise the certificate of product registration of the approved antigen kits to include home testing. Duque says they are waiting for the recommendation of the Technical Advisory Group for the guidelines should the use of self-administered test kits be allowed. The Secretary also underscored the importance of ensuring the accuracy of results should home testing be allowed in the country.
But we really have to educate our people how to do it correctly. So the FDA, I have prodded, but unfortunately, DJ Eric resigned. for personal reasons, no? To make sure that the CPR of the currently available antigen test kits will be revised to include the home home testing.
Currently, there are no FDA-approved self-administered home kits yet in the country. The Department of Health recommends the use of antigen test kits only for individuals with symptoms. When asked whether they are looking into subsidizing the test, the palace says it is included in the discussion.
We're looking at different options for us, for the national government, for the LGUs, and even for private individuals. It has to pass through FDA. FDA has to approve. We have to have our health experts to chime in.
Presidential aspirant Senator Manny Pacquiao is seeking an investigation on private hospitals that refuse to properly compensate their healthcare workers amid the new wave of COVID-19 cases in the country. Meanwhile, Vice President Leni Robredo hits back at fake news that her daughters violate quarantine protocol. Nel Maribuhok will tell us why.
Senator Manny Pacquiao has called on the government to launch a crackdown on private hospitals that refuse to properly compensate their healthcare workers. Pacquiao said in a statement that many private hospitals and healthcare facilities are now understaffed or are manned by inexperienced personnel because of bad management and unfair labor practices. He said the country is losing good doctors, nurses, and other medical professionals because they are not properly compensated. Meanwhile, Vice President Leni Robredo called out fake news peddlers on social media for claiming that her daughters did not follow COVID-19 quarantine protocols. Robredo said Trisha tested positive for COVID-19 on December 25 during 5th day of mandatory quarantine. She was then transferred to an isolation facility. She was released then after tested negative for COVID. Aika and Jillian tested negative for COVID after 5 days of mandatory quarantine and finished quarantine at home. Manila Mayor Isko Moreno visited today the ongoing drive-through booster shot for delivery riders in Bonifacio Shrine. Moreno said the city of Manila again experienced a renewed interest in getting vaccinated.
Kasi yung Manila Health Department nakakalat ngayon sa ating mga malls, sa ating mga community schools, sa ating mga health centers. At lumobo by 200% yung load ng vaccination natin.
Senator Panfilo Lacson is now under self-isolation after being exposed to his son who recently tested positive for COVID-19. Lacson in his Twitter post expresses dismay over the result of his RT-PCR test, which has yet to be released even after 40 hours. His party, Partido Reforma, released a statement saying that all of Lacson's scheduled engagements until January 16th have already either been cancelled or rescheduled. Meanwhile, Ferdinand Bongbong Marcos in his FB post shared how their donated satellite dish in Odette heat areas are now operational. He hopes for the quick recovery of families affected by the typhoon amid the threat of Omicron variant. Nel Maribuhok, UNTV News and Rescue. We serve the people, we give glory to God.
The Commission on Elections has trimmed anew national aspirants for the 2022 polls, particularly presidential bets and senatorials. Asha Kadapan Jr. tells us why.
From 15 presidential aspirants based on December 24, 2021 tentative list released by the poll body, the Commission on Election has further trimmed down the list of presidential bets to 11. Comelec spokesperson Director James Jimenez has recently disclosed the list will continue to decrease as cases filed against some aspirants will have resolution.
Tentative list will change, mababawasan. Hindi siya madadagdagan siguro, no? So, ano yan? Again, yung mga motions for reconsideration at yung mga certificate of finality of decision, yun na lang hinihintay natin.
Still in the list are Ernie Abella, Gerald Arcega, Leody de Guzman, Manila Mayor Isko Moreno Dumagoso, former Defense Chief Norberto Gonzales, Senator Ping Lacson, Faisal Magundato, Bongbong Marcos, Jose Montemayor Jr., Senator Manny Pacquiao, and Vice President Leni Robredo. Removed from the race are Andes Hilario, Danilo Lihay-Lihay, Maria Aurora Marcos, and Edgar Niez. Meanwhile, vice presidential bets remain at 9 to include Lito Atienza, Walden Bello, Rizalito David, Sara Duterte, Manny Lopez, Doc Willie Ong, Kiko Pangilinan, Carlos Serapio, and Senator Vicente Soto III. For senatoriables, from previous 70, it went down to 64. Jimenez meanwhile clarified that even though an aspirant has a pending case, he might still be included in the printing of ballots.
For other cases, again, just like a disqualification case, for example, where the issues are more complicated and probably take longer to resolve, hindi sila matatanggal, right? But they will be able to proceed because there would be nothing hindering their candidacy at that point.
Some cases which the poll body need to resolve include petition to declare as nuisance candidate, disqualification cases, and cancellation of COCs. Presidential aspirant Ferdinand Bongbong Marcos Jr. has the most challenged candidacy with 8 petitions filed by several groups. But BBM's cases decreased to 5 after the dismissal of the other cases. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Amid the challenges faced by workers due to restrictions brought by the COVID-19 pandemic, demand for seafarers are reaching pre-pandemic levels. Eileen Cerudo will tell us why.
More opportunities are opening for sea-based workers, giving seafarers in the country a chance to return to work, according to Overseas Workers Welfare Administration.
Sa sea-based ay halos pumapantay sa pre-COVID levels yung deployment ng sea-based workers. Kaya nakikita natin talaga na nanunumbalik sa usual demand.
OWA Administrator Hans Leo Kakdak said despite the increase in demand for sea-based workers, demand for land-based workers is still low due to the surge of cases in various countries amid the Omicron threat. The agency, however, remains optimistic that foreign employers will still provide work opportunities for overseas Filipino workers. Foreign employers still have high regard for the skill set, loyalty, and credibility of OFWs.
Dito sa pandemya, syempre nagiging factor din yung kalusugan. Kaya't ang nakikita natin dito ay syempre titignan din yung health conditions or situation dito sa ating bansa. Pero sa tingin ko, kasi pandaigdig ngayon itong pagkalat ng Omicron variant, no? So sa tingin ko magkakaroon din ng pag-uunawa ng mga foreign host country governments and foreign employers patungkol sa mga workers natin.
Meanwhile, the Department of Labor and Employment hopes that the heightened alert level restrictions, as well as the onslaught brought by Typhoon Odette, will not be as impactful on the country's unemployment rate. DOLE continues its assessment to determine whether more job opportunities will be available this year. Several sectors in the country, including the agriculture sector, wholesale and retail, and the information and communication center, already recovered from the pandemic's impact.
Inaasahan ho natin na kahit January 15 po yung initial alert level 3, baka lang lumawig pa beyond January 15. So sana naman po huwag mangyari ito dahil nakakabawi na ho tayo tas bigla na naman po tayong uurong. Sana tuloy-tuloy lang po yung sustained and full economic and employment recovery po ng ating bansa.
The Labor Department previously estimated 200,000 jobs will be affected after the National Capital Region was placed under Alert Level 3. More jobs will be affected after Cavite, Rizal, Bulacan, and Laguna also shifted to higher alert level restrictions. Eileen Cerudo, UNTV News and Rescue. We serve the people. We give glory to God.
Commuters appealed to the government to suspend the operation of the NLEX bus terminal as endpoint of provincial bus routes from North Luzon. The Land Transportation Franchising and Regulatory Board, however, stands by its directive in prohibiting provincial buses from operating in their private terminals within Metro Manila. Asher Cadapan Jr. details why.
The resolution issued by the Interagency Task Force for the Management of Emerging Infectious Diseases in February 2021 mandates provincial public utility buses to use designated integrated terminal exchange in their operations. It is a measure of the national government to lower the risk of COVID-19 transmission amid the pandemic. But as threat of different variants of the disease continue in the country, the Land Transportation Franchising and Regulatory Board is determined to implement the directives of the IATF until it withdraws its resolution. This as public commuters appeal to suspend the utilization of North Luzon Express Terminal or NLET in Bocaue, Bulacan, as it brings so much burden against provincial bus passengers. The Filipino Society and Development Advocates Commuter Consumer or Pasada CC explains that the government should provide convenience, especially to public commuters amid the crisis.
Nasa period tayo ng pandemic, sana maintindihan na pansamantala mo, wag na muna hong paggamit. Kung ano naman po yung nakaka-convenience sa commuter ngayon, dapat to, yun po sana ang gawin.
The commuter group also contradicts the claim of the LTFRB that the operation of about 85 private terminals of the provincial buses within Metro Manila poses high risk in COVID-19 transmission.
Dapat yan commuter-friendly. Katulad po ng PITX dito po sa May Parañaque. Kumpleto po yan. Kinonstruct para sa commuter at para sa mga bus. Doon po kaya doon sa Bocaue, masasabi ho natin ganyan. Medyo question mark pa rin ho yan ngayon. Ikalawa po, meron ho tayong pandemic. So yung ganong kalaking area at dadagsasa yung mga 200,000 commuters a day, kaya ho kaya ng pasilidad.
Netizens also expressed their disagreement against the utilization of the NLEX bus terminal. In a social media post of the agency, some netizens say it will be riskier against their health and discomforting to travel for passengers, particularly elders, persons with disabilities, and those traveling with minors. Furthermore, getting from one ride to another may also be costlier on their end, while others explain that all these challenges lead some passengers to ride a Colorum van to have a safer and more convenient travel. Despite all the appeals, the LTFRB stands by its directive in utilizing the integrated terminal exchanges. The agency warns any provincial public utility bus operators and drivers who will operate in their private terminals within the metropolis that they will be penalized if they have been proven to have violated their orders. Asher Cadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Unvaccinated senior citizens in the National Capital Region decided to get vaccinated against COVID-19 during the government's one-day vaccination drive. JP Nunez will tell us why.
After Metro Manila was placed under Alert Level 3 restrictions, local government units passed ordinances limiting the mobility of unvaccinated individuals.
Binigyan po kami ng mandato na ang mga hindi pa bakunado pag lumabas ay kinakailangan po nating hulihin. Nagkaroon tayo ng ilang mga katanungan diyan sa lalabas sa pila at yun naman po yung kanilang sinabi na kinakailangan na raw nila magpabakuna ngayon. Katunayan po diyan ay may mga binuo na po tayo mga federations na mga manghuhuli sa mga hindi pa po bakunado dito po sa Bagong Silang.
With this policy, several unvaccinated senior citizens in Metro Manila took the opportunity today to get their COVID-19 shot during the Senior Citizen Vaccination Day program. During the event, senior citizens were given priority in vaccination sites for them to easily receive COVID-19 vaccine.
Kailangan ko yun. Siyempre, papasok ako ng bangko o pa alis-alis ba? Yun na, kasi kung wala kang vaccine, hindi ka makakalabas.
Kasi na-experience ko before, hindi ako makapasok sa mall kasi walang bakuna. Required talaga. Dapat fully vaccinated para makapasok ka. Parang mas magang kalooban mo kasi may protection ka na eh. Bakunado ka na eh.
Kaya ako nagpabakuna na ngayong araw na to dahil inisip ko na tama yung mga nagsasabi sa akin. Kasi nakikita ko ng dami na eh. Nadadagdagan yung nagkakaroon ng sakit. Kaya na ako, nagpabakuna na ako.
The Department of Health NCR conducted Vaccination Day for senior citizens in Metro Manila since more than 50,000 out of 1.7 million senior citizens target to be vaccinated have not yet received any vaccine dose. DOH Regional Director Gloria Balboa explains senior citizens are among the top priority group as they are vulnerable from COVID-19 contraction and vaccines will provide them additional layer of protection.
Dati kasi parang passive lang. Sige, pumunta may gusto. Pero ngayon, in-intensify natin ng information dissemination. Tapos talagang hinikayat sila na pumunta dito. At yung mga hindi makapunta dahil nga bedridden, pupuntahan para makover lahat itong hinahanap natin 52,000 plus.
The National Task Force Against COVID-19 previously said more than 2.5 million senior citizens in the country are still unvaccinated, while others are still hesitant due to the possible side effect of COVID-19 vaccines. JP Nunez, UNTV, News and Rescue. We serve the people. We give glory to God.
And for the news abroad, multiple cases recorded in Brazil reveal residents are falling ill to both the coronavirus and influenza recently identified flurona. This has caused some concerns about the effect on Brazil's healthcare system, says Estevão Urbano, the director of Brazil's Infectious Disease Society, claiming that though most cases do not require hospitalization, both are risks and small percentages of cases will overwhelm hospitals. Currently, there have only been 6 confirmed cases of flurona. However, there are 17 potential cases. Health Secretary João Gorechitai of Sao Paulo commented on the increasing cases of both viruses, stating that at a time where people are most careless with masks and social distancing, it is not a surprise to see prevalent transmissions. The International Olympic Committee reassured officials around the world that the Beijing Olympics will be going ahead. Paul Gatchalian will give us the details live. Yes, Paul, please go ahead.
Ariel, despite fears over the increasing number of COVID-19 cases, the IOC gave assurances through a video conference with the team about the Winter Olympics to be held next month. International Olympic chiefs also promised case-by-case assessments for athletes who recover after testing positive for COVID-19 before traveling to China. The announcement came after Swiss team leader Rolf Stockley raised concerns over the rising number of athletes getting infected by COVID and how it will be very difficult if the best athletes will not be present at the event. After encouraging discussions around the possibility of postponing the Beijing Games, Mr. Stockley and the Swiss team said they are now happy to have some certainty on the subject. Olympic organizers in Beijing and the IOC will be implementing a health safety bubble with more strict testing and limits on travel from last year's Tokyo Games. Marielle?
Paul, what are some of the rules that attendees must follow for the Olympics?
Well, Marielle, a 21-day quarantine applies to athletes, officials, and workers who are not fully vaccinated, while fully vaccinated participants may enter the country without quarantine requirements. But daily testing applies for all participants and officials. They will also be kept strictly with a closed loop stated in their playbook to avoid contact with the public. Participants are also required to take 2 separate COVID-19 PCR tests prior to their travel, and if either of the tests are positive, they are not allowed to enter China. Back to you, Marielle.
Thank you, Paul Gatchalian, reporting live from New Zealand. Meanwhile, number 1 tennis star Novak Djokovic has been denied entry to Melbourne, Australia, when his plane landed Wednesday night after the Australian Border Force, or ABF, cancelled his visa due to lack of appropriate evidence providing his medical exemption for being unvaccinated. Australia's border entry requires travelers to be fully vaccinated. Otherwise, unvaccinated travelers must provide a medical exemption document, which reportedly Djokovic failed to comply, as confirmed by Australia Prime Minister Scott Morrison.
Rules are rules, and there are no special cases. Rules are rules. It's what I said to you yesterday. That's the policy of the government. The ABF has done their job. Entry with a visa requires double vaccination or a medical exemption. I'm advised that such an exemption was not in place, and as a result, he is subject to the same rule as anyone else.
Health Minister Greg Hunt said it was up to Djokovic whether he wanted to appeal the decision. For the first time in medical history, a drone played a crucial part in saving the life of a 71-year-old man in Sweden when he suffered a sudden cardiac arrest while shoveling snow in his driveway. Maeve Vendog will give us the details live. Yes, Maeve, good evening.
Marielle Ever-Jones' Emergency Medical Aerial Delivery or EMAD service was put to the test in December when it delivered a defibrillator at the incident address. It took just over 3 minutes for the automated external defibrillator or AED to arrive while Dr. Mustafa Ali provided CPR to the said patient, kick-starting the life-saving process before the ambulance arrived. The patient, who has now made a full recovery, stated that the drone is a revolutionary technology that needs to be implemented, as sudden cardiac arrest can happen to anyone. Everdrone CEO Matt Salstrom explained that the cutting-edge drone technology is fully equipped with emergency dispatch and is designed to deliver AED equipment as quickly as possible. This is very critical as heart attack patients need help within 10 minutes. The full study on the drone system is published in the European Heart Journal and has been scientifically established to cut response times for out-of-hospital cardiac arrest patients. Marielle?
Maeve, can you please tell us the statistics of patients who might benefit from this drone technology in Europe?
Yes, Marielle, about 257,000 patients in Europe suffer from cardiac arrests annually, and around 70% of them occur in private homes without AEDs on site. The current survival rate among them is around 10%, considering that ambulance response times are often too long to save the lives of this kind of patients. The EMAD service, Marielle, can currently reach 200,000 residents in Sweden. This year, it is also expected to expand to more locations in Europe. Back to you, Marielle.
All right, thank you for that live report. Maeve Vendog reporting live from Australia. And those are the reasons behind the news in other parts of the globe. I am Maria Latoza reporting live from Perth, Australia. Good evening.
A Ghanaian mom's wish for livelihood capital has been granted by Members Church of God International because MCGI cares. Nina Armilio has this story.
From one business to another, Justin always worries about her capital. From breads to donuts, 45-year-old Justin takes care of business. But what can she do if her measly income stays measly? In a week, she earns only 45 Ghanaian cedis or $7.29 US.
Nema chile jaja mafokato ayala we agbova badureta alacha edoma jai gakeje mangafo de nono meta fukpeta je mangafo netale venite afide la fole venite de fukpeta je ma itoji bekase ga mafe mama tapo Agbana to makitobo makunole. Matako akono wenye fupa kitole. Emoja jerame. Ako wene mele tefeti kala kumale flobo. Taji wa mano chushimano chacha. Maiti zipeki to matai. Hey mtu matoa pewe. Ano chacha. Ano yi. Ape mato makbo. Enu pe fole la po fole na pe mako. Amaruben kitoma ko agbana. He mako ka koko na we. Yenye fupa kitome. Ito mele. Ito wame.
This is as hard as it gets, she says. Still, she doesn't lose hope that there are people who can help her with her business.
Okay, mo Jessimia beganya be. Egaulisa. Evota ntome. Bekpo hare kapo ne ajawaba. Be amegbeto. Seken melesiu. Yakpora milenduru nami. Chura resiade. Amegbeto resele. Nekpo jijemi. Eya nyen ke hinyi ne sekpo la fireke. Bejokpo. Kakele chochole mi abegame. Apo be ejebe no mesito ne no se. Meketo si agbale la. Ni uda agbale ota. Meketo la vifala. To zonu kola. Enye mi abe tesitete ke amekpo le mi abegam.
Her only wish is to be able to feed her family and provide for their children's needs.
Paparon se mejibe maubaga mena wana mwenyebe. Nipa sindo anu nipe flour, nipa mi, nipe sugar, nipe margarine. Pele kokloze, pele nipe ndo wana. Ende mejibe gas maubaga ne wana. Be mata kono ndo wana.
The Bible teaches us to do all things with charity. That is why Members Church of God International, with God's mercy and guidance, granted Justin's wish for help in her business. With faith, hope, and love, MCGI gave her ingredients and materials to use in selling. Now she doesn't need to worry about paying for the capital because these are all MCGI's gifts. Akpenamau, thanks be to God for another opportunity to do good, another chance to be a small instrument in spreading God's love, which will continue with God's help, because MCGI cares.
Before we close, we will leave you with a word, giving glory to God. From the book of Psalms, chapter 36, verse 10. It says, O continue thy loving kindness unto them that know thee, and thy righteousness to the upright in heart. And those are the reasons behind the news, January 6, 2022. Reasons we deliver to you as they unfold. I am Herlene Delgado.
And because we need to know, we will always ask why. I am William Theo. We serve the people. We give glory to God.